that right?
Did you say even?
Yes.
Yes.
Okay. Come on. Nope. That's not the right one. All right. Bear with me, guys. We're having technical issues. There we go. Well, it may not be technical issues. It may be operator issues this morning. All right. Okay. Can everyone still see my screen?
No.
Okay. All right. How about now?
No. There you
So,
go.
okay. Chapter 19, we're doing even. So 2 is true, 4 is true, 6 is true, 8 is true, and 10 is true. 2, 4 is false, 6 is false, 8 is true, 10 term, 2 is G, 4 is N, 6 is K, 8 is M, 10 is D, 12 is E, 14 is L, and 16 is B. 2, on evaluation of learning. To ensure that the test results are reliable and valid. 4, when a new lot number of testing reagents is put into use. Deterioration of testing components due to improper storage, improper environmental testing conditions, or errors in technique used to perform the procedure. 8, glucose is the chief source of energy for the body. 10, A is FBG, B, PPBG, C, OGTT. 12, to evaluate the progress and regulate treatment of a person with diabetes and as a routine screening procedure to detect pre-diabetes and diabetes. 14A, 70 to 99, B, 100 to 125, and C, 126 or above. 16, a blood specimen is collected 2 hours after consumption of a meal or glucose solution. 18, consumption of a high carbohydrate diet for 3 days before the test, consisting of 150 grams of carbohydrate per day. The patient must be in a fasting state when the test begins. Number 20, a condition in which the glucose in the blood is abnormally low occurs with an overdose of insulin, Addison's disease, bacterial sepsis, carcinoma of the pancreas, hepatic necrosis, and hypothyroidism. Number 22, 4 times a day, in the morning after an 8-hour fast, before lunch, before dinner, and at bedtime. Number 24, convenience of testing, more patient involvement in self-management decisions, reliable decisions regarding insulin dosage, and decreased long-term complications. 26, the average amount of glucose in the blood over a 3-month period. 28, less than 7%. 30, each time a new container of test strips is opened. 32, most of the cholesterol circulating in the blood is manufactured by the liver. A portion of it comes from an individual's diet, dietary cholesterol. LDL picks up cholesterol from ingested fats and the liver and delivers it to blood vessels and muscles where it is deposited in the cells. An excess amount of LDL cholesterol can cause plaque to build up on the arterial walls, resulting in arterial sclerosis. HDL removes excess cholesterol from the walls of the blood vessels. 36, A, less than 200, B, 200 to 239, C, 238, to screen for the presence of high blood cholesterol related to CAD. 40, A, less than 150, B, 150 to 199, C, 200 to 499, D, 500 or higher. 42, to detect kidney disease. 44, bacteria and viruses, bacterial toxins, allergens, and blood antigens. 46, through saliva by direct oral contact. 48, clumping or agglutination of red blood cells. 50, clumped red blood cells cannot get through the small tubes of the kidneys, which may lead to kidney failure, and the clumping of red blood cells lead to hemolysis of red blood cells. 52, B antigen, A antibody. And 54, no antigens, A and B antibodies. Okay, make sure that you guys send me your results for chapter 19. And then we're going to go ahead and open our books to chapter 7. And that is on page 208. All right, Introduction to Tissue Healing. Physical agents are often employed in the medical office to promote tissue healing for individuals who experience a disability as a result of injury, disease, or loss of a body part. Physical agents are used therapeutically to improve circulation, provide support, and promote the return of motion so that the individual can perform the activities of daily living. Physical agents frequently used in the medical office include heat and cold applied locally, and ambulatory aids such as crutches, canes, and walkers. Local application of heat and cold. The application of heat and cold is used therapeutically to treat conditions such as an infection and trauma. The medical assistant may be responsible for applying various forms of heat and cold at the medical office, or for instructing patients in the proper procedure for applying heat or cold at home. The medical assistant should have a basic understanding of the physiological effects of heat and cold on the body and of possible adverse reactions if they are not administered correctly. Heat and cold can be applied in moist and or dry forms. Highlight that sentence. Common applications of dry and moist heat and cold are as follows. Number 1, dry heat, heating pad or a chemical hot pack. 2, moist heat, hot soak or hot compress. 3, dry cold, ice bag, chemical cold pack. Highlight number 3. 4, moist cold, cold compress. Heat and cold are applied for short periods, typically 15 to 30 minutes. Highlight that. To produce the desired therapeutic results. The application may be repeated at time intervals specified by the provider. Prolonged application of heat or cold is not recommended because it can result in adverse secondary effects. The type of heat or cold application used for a particular condition depends on the purpose of the application, the location and condition of the affected area, and the age and general health of the patient. The provider instructs the medical assistant to apply a heat or cold treatment based on these factors. Heat and cold receptors in the skin readily adapt to changes in temperature, eventually resulting in diminished heat or cold sensations. The temperature actually remains the same and it is providing the intended therapeutic effects. The patient not perceiving the same degree of temperature may want to increase the intensity of the application, however, without realizing the inherent dangers. Excessive heat or cold could result in tissue damage. A common example of the situation is a patient who turns up the setting of a heating pad from medium to high when the heating pad no longer feels warm. The medical assistant should fully explain to the patient that necessity of maintaining a safe temperature range during the application. All right, factors affecting the application of heat and cold. Alicia, can you go ahead and read factors affecting the application of heat and cold?
Before applying heat or cold, certain factors must be taken into consideration to prevent unfavorable reactions such as tissue necrosis. The temperature may need to be adjusted based on the following conditions. Number 1, the age of the patient. Young children and elderly patients tend to be more sensitive to the application of heat or cold. Number 2, location of the application. Certain areas of the body are more sensitive to the application of heat or cold, especially the areas of the skin that are usually covered by clothing such as chest, back, and abdomen. The skin on the hands and face is not as sensitive and better able to tolerate temperature change. Broken skin, such as is found with an open wound, is more sensitive to heat and cold and is more prone to tissue damage. Number 3, impaired circulation. Patients with impaired circulation tend to be more sensitive to heat and cold. This impairment may be at the site of the application or may be a systemic problem involving the entire body that is a result of certain conditions such as peripheral vascular disease, diabetes mellitus, and congestive heart failure. Number 4, impaired sensation. Patients with an impaired sensation, such as diabetic patients, must be watched carefully because the tissue damage may occur from the application of heat or cold without the patient's awareness. Number 5, individual tolerance to change in temperature. Some individuals cannot tolerate temperature change as easily as others. The medical assistant should observe the area to which the heat or cold has been applied before, during, and after treatment for signs indicating that a modification of temperature is needed. Prolonged arrhythmia or paleness, pain, swelling, and blisters should be reported to the provider. The medical assistant also should ask the patient whether the application feels comfortable or is too hot or too cold.
All right, very good. So you're going to highlight all of number 1. On number 2, you're going to highlight the last sentence. On 3, highlight the words impaired circulation and diabetes mellitus. All right, Jasmine, can you please go ahead and read local effects of heat?
The application of moderate heat to a localized area of the body for a short time, approximately 15 to 30 minutes, produces dilation or an increase in diameter of the blood vessels in the area as the body tries to rid itself of excess heat. There's 7.1. This results in an increased blood supply to the area, and tissue metabolism increases. Nutrients and oxygen are provided to the cells at a faster rate, and waste and toxins are carried away faster. The skin in the area becomes warm and exhibits erythema.
Arrhythmia.
Arrhythmia. Arrhythmia is reddening of the skin caused by dilation of superficial blood vessels in the skin. These physiologic effects of moderate heat applied to a localized area promote healing. Prolonged application of heat longer than 1 hour produces secondary effects, however, that reverse this healing process. Blood vessels constrict and blood supply to the area decreases. The medical assistant must be careful to apply heat for the length of time specified by the provider.
Very good. Okay, so I want you guys to highlight where it says produces dilation or an increase in diameter of the blood vessels in the area as the body tries to rid itself of excess heat. This results in an increased blood supply to the area and tissue metabolism increases. And then also highlight the last sentence of that paragraph where it says arrhythmia is reddening of the skin caused by dilation of superficial blood vessels in the skin. All right, purpose of applying heat. Lily, can you please go ahead and read this?
Heat functions in relieving pain, congestion, muscle spasms, and inflammation. Conditions for which the local application of heat is often prescribed are lower back pain, arthritis, menstrual cramping, and localized abscesses. Heat promotes muscle relaxation and is often used for the relief of pain caused by excessive contraction of muscle fibers. Edema or swelling is the tissues can be reduced through the application of heat because the increased blood supply functions to increase the absorption of fluid from the tissues through the lymphatic system. Heat, usually in the form of a hot compress, can be used to soften exudates. An exudate is a discharge produced by the body's tissue. Exudates may sometimes form a hard crust over an area and require removal. Heat also increases suppuration or the process of pus formation to help in the relief of inflammation by breaking down infected tissues. Heat is not recommended, however, for the initial treatment of acute inflammation or trauma.
Okay. So in the first paragraph, you're going to highlight the last sentence. And in the second paragraph, I want you to highlight the words edema or swelling. Now, how many of you have applied a heating pad when you may be experiencing your menstrual period? Yep. Yeah, most of us probably have at one point to another. Now, how many of you have felt like it's just not hot enough and so you cranked it up? Yep, Sabrina, sometimes just for fun because it feels good. Yep, exactly. So remember that as we're going through this chapter, right? Because sometimes if we're doing it, you have to remember that our patients are probably going to do it too. And this is where instructing our patients on how to properly form these therapeutic treatments is going to actually help them heal safely. So just remember that if, Sabrina, you've had very bad luck with heating them up. What do you mean? Next, oh, yeah, don't do that. That's dangerous. Yeah. Yeah, that's dangerous. So yeah, just remember that again, if we've done it, more than likely our patients are going to do it too. So this is where our trial and errors may benefit when we explain the patient on the proper procedures. All right, very good. So the types of heat application. The most common types of heat application are described next, along with the conditions they are often used to treat. Nancy, go ahead and read heating pad, please.
The electric pad consists of a network of wires that function to convert electric energy into heat to provide a constant, even heat application. The wires must not be bent or crushed. This could damage the pad, resulting in overheating of parts of the pad and leading to burns or fire. Pins must not be inserted into the pad as means of securing it. If a pin comes into contact with a wire, an electric shock could result. To prevent electric hazard, heating pads should not be used over areas that contain moisture, such as wet dressing. Heating pads are often used to relieve pain and muscle spasms.
Very good, thank you. All right, Natalie, can you please go ahead and read hot soak?
A soak is the different immersion of a body part in water or a medicated solution. A soak can be applied to an extremity or a part of the torso. Hot soaks are often prepared using a ratio, for example, 2 parts water to 1 part medication, and are used to cleanse open wounds, increase suppuration, increase the blood supply to an area to hasten the process, and apply a medicated solution to an area.
Very good. Sabrina, go ahead and read hot compress.
A hot compress is a soft, moist, absorbent cloth, such as a washcloth, that is immersed in a warm solution and applied to a body part. Hot compresses are used to increase suppuration, to improve circulation to a body part, to aid in healing, to promote drainage from infection, and soften exudates. Applying a hot compress to an open wound requires the use of a sterile technique.
All right, very good. Talia, can you go ahead and read chemical hot pack, please?
Chemical hot packs are available in a variety of sizes and shapes. When activated, they provide a specific degree of heat for a specific period of time, usually 30 to 60 minutes. As indicated on the package label, a chemical hot pack consists of a vinyl bag containing calcium chloride crystals and a smaller bag encased in a vinyl bag containing water. Pressure is applied with the hands to break the inner bag. The water in the inner bag combines with the calcium chloride crystals to produce heat. After using the pack, it should be discarded in an appropriate receptacle. Chemicals hot packs should be stored at a room temperature and are used as an alternative to a heating pad to relieve pain and muscle spasms. Procedure 7.1, 7.2, 7.3, 7.6 presents the proper application of heat with a heating pad, a hot soak, a hot compress, and a chemical hot pack.
All right, very good. So has anybody heard of a chemical hot pack before now? All right. Alicia, go ahead and explain in your words, what a chemical hot pack is for those that may not know.
It's like a hard piece of, I don't know how to explain it. And it's like there's this little bubble in the corner that you just pop, and then it just turns the whole thing like this color, and then it gets warm.
Mm-hmm. Yeah, exactly. And there's a chemical cold pack too, right? Like if you were to sprain your ankle, you may see your doctor, or even maybe at home, you have like this blue liquid, and you keep it in the freezer, or you have just this little white square pack and you pop it, and all of a sudden it gets cold. Well, the hot packs serve the same purpose, except when you pop them, it goes hot instead of cold. So you'll see both of these. They're pretty cool. All right. Any questions so far, ladies? Okay. So let's take a quick look before we read our first case study at figure 7.1. So look at the effect of heat application. So with heat, they dilate the blood vessels. And with cold, it's constricted. So that's kind of a way to remember what heat and cold applications will do. All right, case study number 1. Aaron Collins is at the office. Aaron recently helped a friend move, and the next day he developed intense pain in his lower back. To alleviate the pain, he slept on a heating pad, but when he woke up, his back was red and blistered. Aaron says that he turned the setting on the heating pad to high because his back was hurting so much, and he thought that it would help his back feel better sooner. Aaron wants to know the best way to apply heat using a heating pad. He also wants to know what he can do to prevent low back pain in the future. All right, so what would you do?
We can explain to him how the parts of the body that he put it on is sensitive, so he needs to make sure that he doesn't have it too hot, so that way it doesn't blister for the next time he uses it, or maybe put like a bed sheet or something in between them, so it's not as like right on the skin. You know what I mean?
That's right. Yeah, you want to always, even whether it's heat or cold, you want to always do a layer of something, whether it's a washcloth, a towel, in between the temperature, the heat or cold compress, or whatever therapy you're using, and directly to the skin. That's right.
Um, we could also tell him that the next time he does something high intensity, or like helps a friend move, he can practice proper lifting methods, and also he could wear like a back brace while he's doing stuff like that, especially if he has like back problem.
That's right. Yeah, we want to go ahead and take this as a teaching moment so he knows next time maybe to make sure on what he's doing, so hopefully he won't hurt his back again. Very good. All right, anything else?
Miss Daniels,
Yes.
kind of curious. Do we want to recommend him not to sleep with the heating pad, or is that okay?
Well, so that's actually a really good question. Um, a lot of people, I mean, even including myself, right? I'm guilty of doing that. But I think I think it's okay to advise him that he didn't do anything wrong, right? Just make sure that when he does go to sleep, or he starts feeling sleepy, he goes ahead and either turns it down, or make sure that he has something wrapped around the heating pad so it's not directly close to his skin. So I wouldn't say that, I mean, I wouldn't, because, I mean, I've done it, right? But we just, again, that would be a good teaching moment. Now, if you find yourself in that case, the best thing I would recommend you ladies doing is, you know what, let me go make sure with the provider that he's okay with you doing that, and maybe just making sure it's right. Because most of the time they are, but that way you know the provider's input on that type of situation. So that's a really good question. All right, anything else? This one's probably pretty easy, I think. Okay. So, guys, I'm going to pause this for just a second so I can go unlock the front door for the cabinet people, and then we're going to start by reading the local effects of cold. And Alicia, if you want to go ahead and read that, and I'm going to be right back.
The application of moderate cold to a localized area produces constriction or a decrease in diameter of blood vessels in the area as the body attempts to prevent heat loss. See figure 7.1. This constriction leads to decreased blood supply to the area. Tissue metabolism decreases, less oxygen is used, and fewer wastes accumulate. The skin becomes cool and pale. Prolonged application of cold longer than 1 hour has a reverse secondary effect. Blood vessels dilate and tissue metabolism is increased. To prevent secondary effects, the medical assistant must apply cold for the recommended length of time only.
All right, very good. Oh, let's see here. Jasmine, can you go ahead and read the purpose of applying cold?
The application of moderate cold for a short time is used to prevent edema. Cold may be applied immediately after an individual has sustained direct trauma such as a bruise, minor burn, sprain, strain, joint injury, or fracture. The cold limits the accumulation of fluid in the body tissues by constricting blood vessels and reducing the leakage of fluid into the tissues. Through constriction of peripheral blood vessels, cold can be used to control bleeding. Cold temporarily relieves pain through its anesthetic or numbing effect, which reduces stimulation of the pain receptors. Cold also slows the movement of blood and tissue fluids in the affected area, resulting in less pressure against pain receptors and therefore less pain. In the early stages of an infection, the local application of cold inhibits the activity of microorganisms. In this way, suppuration is decreased and inflammation is reduced. Cold application should always be placed in a protective covering because applying cold directly to the skin could result in a skin burn.
Very good. Okay, so for the purpose of applying cold, you're going to only highlight the first sentence. Okay, Sabrina, thank you. Now, remember, just like with the effects of with hot, if it's direct skin contact, it can lead to kind of like a burn, right? Well, the same thing can happen with our cold therapy. So again, you always want to make sure that you have some type of coating, right? Like if we're going to do an ice in a bag, which we're about to go over, you want to make sure you wrap that in a washcloth, a kitchen towel, something so it's not directly on top of the skin to skin contact. All right, very good. Types of cold application. Lily, can you go ahead and read ice bag?
An ice bag consists of a waterproof bag with a screw-on cap. Before use, it must be filled with small pieces of ice and placed in a protective covering. Ice bags are used to prevent swelling, control bleeding, and relieve pain and inflammation.
All right, very good. So quick question, because just like with heat, it can relieve inflammation, right?
Correct.
Okay, and apparently so can cold. So how would you know which one to do?
Wait, what are you asking?
I normally do hot though.
So if someone's having inflammation, right? Let's say they fell and they sprained their ankle and their ankle is swollen, right? It's inflamed. After reading heat and part of the cold, how would you know which one to recommend for your patient?
So for a swollen, you would do ice because you don't want the swelling to get any worse and you want the swelling to go down.
That's right. All right. Now, what would be another example? Can you give me another scenario?
So the same would go for like a knot on the head. If you fell and somebody has bumped their head and has an egg on their head, you would want to put a cold compress on there to reduce the swelling.
That's right. Tina, what do you think would happen if someone was to not do cold and they were to do heat?
That could make the blood flow, the swelling, the underneath the skin get bigger. Like for a bump on the head. If
Yes. So
there,
remember, that's where that figure on 7.1 is going to come to play, right? Even though the cold and hot therapy, right, can be used for the same symptoms, it also is going to depend on what body part and what the incident was, right? Like if it was a strain, we don't want to do heat, right? We want to calm those blood vessels down, and that's where the cold is going to be the recommended. If someone if someone did a muscle spasm, that's probably where the heat would actually be more beneficial for the patient than the cold. So it's just to remember, the only reason I'm asking this is I want you guys to keep in mind and start getting yourself to not only ask, what happened, also find out what body part it is, right? And remember the fact of, do we want to dilate or do we want to constrict the blood vessels? If we want to constrict the blood vessels, what therapy would that call for?
cold.
Cold, that's right. And if we want to dilate the blood vessels, that would be
Hot.
That's right. Very good. Okay. Nancy, can you go ahead and read cold compress?
Ma'am. A cold compress is a soft, moist, absorbent cloth such as washcloth that is immersed in a cold solution and applied to a body part. Cold compresses are used to relieve pain and inflammation and to treat conditions such as headache, injury to the eye, and pain after tooth extraction.
All right. Very good. Natalie, go ahead and read chemical cold pack.
Chemical cold packs are available in a variety of sizes and shapes. When activated, they provide a specific degree of coldness for a specific period of time, usually 30 to 60 minutes, as indicated on the package label. Most cold packs consist of vinyl bag of ammonium nitrate crystals. Enclosed in this bag is a smaller vinyl bag of water. The cold pack is activated by applying pressure until the inner bag ruptures. This releases the water into the larger bag, and a chemical reaction occurs between the crystals and the water, producing coldness. These packs are disposable, and when the coldness diminishes, they should be discarded in an appropriate receptacle. Chemical cold packs should be stored at a room temperature. They are used as an alternative to ice bags for local application of cold to prevent swelling, control bleeding, and relieve pain and inflammation. Procedures 7.4, 7.5, and 7.6 present proper application of cold with an ice bag, a cold compress, and a chemical cold pack.
All right. Very good. So for chemical cold pack, you're only going to highlight where it says chemical cold pack should be stored at room temperature. And for our chemical hot packs, Alicia brought up the question of hot hands, right? Like in the winter, we'll get like the little hot hands, and that would be an example of a chemical hot pack. A chemical cold pack would be similar, except usually they're in like a white plastic and they're squishy, but then you feel something hard. And then if you press that and mix that all together, you're going to start feeling the cold sensation. So that's your chemical cold pack. All right, very good. So go ahead and turn to page 212. And again, just like all the other chapters, you're going to want to make sure you read the procedures, read the figures, things like that. On page 212, under the patient teaching low back pain continued, I want you to highlight the bullet point where it says encourage patients to follow practices that prevent strain to the lower back, such as using correct lifting techniques. In procedure 7.1 for applying a heat pad, I want you to highlight number 4, procedural step and principle. And the last sentence on number 6, procedural step. And then I want you ladies to turn to page 216. And you're going to highlight number 5, procedural step and principle. And then we're going to turn to page 218. All right, Talia, can you please read the first paragraph under cast?
A cast is cylindrical casting that is used to embolize a body part. Casts are applied most often when the individual sustains a fracture. Figure 7.2. The cast keeps the fracture bones aligned until proper healing occurs. Casts are also used to support and stabilize weak or dislocated joints to promote healing from a surgical correction, such as a knee surgery, and to aid the non-surgical correction of deformities such as congenital dislocation of the hip.
Very good. Okay, so I want you ladies to highlight where it says the cast keeps the fractured bones aligned until proper healing occurs. Alicia, can you go ahead and read the next paragraph, please?
Casts are applied by an orthopedist, also known as an orthopedic surgeon. An orthopedist is a physician who specializes in the diagnosis and treatment of disorders in the musculoskeletal system. An orthopedist treats patients with deformities, injuries, and diseases of the bones, joints, ligaments, tendons, muscles, nerves, and skin. The role of the medical assistant in cast application is to assemble the equipment and supplies, prepare the patient for the procedure, and assist the provider during the application, provide or reinforce cast care instructions, and clean the examining room after the application.
All right, very good. So you're going to highlight the first sentence on that paragraph. Jasmine, can you go and read the next paragraph?
An important goal of cast management is the prevention of pressure areas, which are most apt to occur over bony provinces. A pressure area occurs when the cast presses or rubs against the patient's skin and provides adequate circulation to the area. When this occurs, the patient usually feels a painful rubbing, burning, or stinging sensation under the cast. If permitted to continue, the pressure can cause the skin to break down, leading to the development of a pressure ulcer. Figure 7.3. If not treated, a pressure ulcer progresses from a simple red patch of skin to erosion into the subcutaneous tissue and eventually erosion into the muscle and bone. Deep pressure ulcers often become infected by invading organisms and develop gangrene. It is important to detect the occurrence of a pressure area early so that prompt treatment can be instituted to prevent serious complications.
All right, very good. So has anybody heard of a pressure ulcer or even gangrene?
Yes, I have.
All right, very good. Tell me about that patient, because I know you work in the medical office. I think this would be good for everyone to kind of hear and get an idea, because this is really, really common for you to see as a medical assistant.
So in one case, a little girl had a cast on her arm, and where the cast kind of went around her thumb area, and in between her thumb, that little soft spot, it rubbing, and it made a big, huge sore, open sore there.
All right, very good. And what did y'all do to treat that patient?
So the doctor put some kind of like the maybe a liquid bandage over, I think is what it was called, and then we put more. There's this white stuffing stuff that goes underneath the cast. I don't know what it's called.
Yeah, that's exactly what we're going to cover that in a minute. But yep, that's exactly what it looks like.
And then we just told the mom to make sure she doesn't pull that out and to keep that under there because that's what's keeping it. That's what's going to stop it from rubbing. And if it comes off, she needs to make sure that she puts something, gauze or anything in between there to keep it from rubbing that sore.
That's right. Very good. All right, good. All right, now let me ask you guys this. what kind of patients do you think you would see more frequently for the common problem of pressure ulcer and gangrene?
Older people?
Okay, yeah. All right, Tina, thank you. Okay, can you kind of go a little further on that?
Hmm.
And there's no right or wrong. I'm just getting I'm getting my medical assistant's brains to start working in multiple ways.
Maybe like older people or someone in hospice who can't move around.
Very good. Okay, so that's a good example. So a lot of our patients who maybe they sit or even lay in beds for a long, extended period of time, they will develop pressures right from the bone. So if the bone pressure sores is what it's called, and it explains exactly what it is. So it's basically where the patient's bone and certain things are just sitting in one spot, and it will develop over time because there's not a lot of blood flowing, right? So it's just a constant bruise on certain areas. Well, over time, that will lead into a sore, and it's really common for like around the buttocks area where the bone will lay, um, and the pressure from the body is being applied. It will also happen on the arms and the back for those kind of patients. So that's a good example. So what's another example of a type of patient that you may see that you would see them having a pressure ulcer?
Older patients get those from being bedridden. They get the ulcers on their, especially like on their backside, on their tailbones
Yeah,
and things
that's right.
from not being moved enough.
Yeah. What do you think another example would be? What kind of patients?
Patients that are disabled,
Okay.
maybe that don't have mobility.
Yeah, very good. All right. What about another one? There's one more. Well, there's probably a lot more, but there's one more in particular. I'm trying to see if you guys can figure it out.
I missed what y'all already said because I had to take a patient back. So.
That's okay. No, you're good. Your first one was the one we just went over. So
Oh,
you're caught
okay.
up. You're good.
Okay.
So our diabetic patients are also very much prone to developing pressure ulcers. Can anybody tell me why? And it's also very common
That.
on the soles of their feet.
Yes.
Why do we think that is?
Diabetics, when they get sores, they have a very hard time, especially on the bottom of the feet. They have a hard time. Their sores have a hard time healing because they don't
Yes,
have good circulation in
that's
their
right.
feet.
That's right. And what's a symptom of someone who has poor circulation in your feet?
Cyanosis. They get
That's
blue.
right. You get blue. Yeah. Another thing is they can't feel their feet, right? Think of it like you sat down on your leg too long, and when you got up, do you feel that tingling, like your blood circulating again, right? Like you sat in a wrong position and your leg fell asleep. For a lot of our older and diabetic, it's most common, they feel that all the time. So because they feel that, they don't check the bottom of their feet, right? They can't feel it. So if and more likely they also get pressure ulcers just because they don't feel that anything's wrong. They're losing their circulation. So most of the time, the doctors will actually, as part of their daily routine, when they come into the office, no matter what they're coming in for, they may go ahead and have you to ask the patient to take off their shoes and socks so I can inspect their feet. So, all right, very good. So just again, you kind of want to get your mind moving. You kind of have to think of all aspects, right? It's not just one typical thing that may cause this. All right, very good. Let's see, where was I at? I think I was on the last paragraph. Lily, can you go and read the last paragraph on cats?
We read that one.
Did we? Okay. So then you're going to highlight where it says a pressure ulcer occurs when the cast presses or rubs against the patient's skin and prevents adequate circulation to the area. And then highlight where it says deep pressure ulcers often become infected by invading organisms and developing gangrene. And then Lily, go ahead and read synthetic cast for me.
Synthetic casts are the most common type of cast used to immobilize the body part. A synthetic cast consists of a knitted fabric tape made of fiberglass, polyester, and cotton and plastic. Tape is impregnated with the polyurethane resin that is activated when soaked in water. Of the three kinds of synthetic material, fiberglass is used the most. Synthetic tape comes in different colors and is packaged as an individual roll and airtight pouch. Synthetic tape is available in width ranging from 2 to 8 inches.
All right, very good. So you're going to highlight where it says a synthetic cast consists of a knitted fabric tape made of fiberglass. All right, cast application. The provider applies the cast so that it fits snugly but still allows adequate circulation necessary for proper healing. 4 to 6 weeks are usually required for the complete healing of a fracture. Highlight that sentence. Casts are classified according to the body part they cover. The type of cast most frequently applied in the medical office and common uses of each are illustrated and described in Figure 7.5. The type of cast applied depends on the nature of the patient's injury or condition. A short arm cast is used for a dislocated wrist, and a long arm cast is used for the fracture of the humerus. The following steps are performed in applying a cast. Number 1, inspect the skin. Highlight that sentence. The area to which the cast is to be applied must be clean and dry. Highlight the patient's skin should be inspected for redness, bruises, and open areas. This information should be documented in the patient's medical record because it may assist in evaluating patient complaints after the cast has been applied. Number 2, apply the stockinette. Highlight that sentence. Before applying the cast, the provider covers the body part with a stockinette. A stockinette consists of a soft, tubular, knitted cotton material that stretches up to 3 times its original width to accommodate the diameter of the body part. It is put on like a stocking. Highlight the purpose of the stockinette is to provide patient comfort and to cover the rough edges at the ends of the cast. Stockinettes come in widths ranging from 2 to 12 inches. The width usually depends on the diameter of the part to be covered. Typically, a 3-inch width is used for arm cast, a 4-inch width is used for leg cast, and a 10 to 12-inch width is used for body cast. Apply the cast padding. Number 3, highlight that sentence. Cast padding consists of a soft cotton material that comes in a roll in widths ranging from 2 to 6 inches. The purpose of cast padding is to prevent pressure areas and to shield the patient's skin when the cast is removed. 2 to 3 layers are applied directly over the stockinette using a spiral turn. Each turn overlaps the preceding one by 1/2 of the width of the roll. Highlight extra layers of padding are applied over bony prominences to prevent pressure areas. Number 4, prepare the synthetic tape. The roll of the synthetic tape is fully immersed in cool room temperature water. Highlight those 2 parts. To 75 degrees Fahrenheit for a period of time recommended by the manufacturer. Fiberglass tape is immersed for 5 to 15 seconds. Highlight that. The airtight pouch containing a roll of synthetic tape should remain sealed until just before it is time to immerse the roll in water. This is because air causes the resin in the tape to begin to harden and become rigid, making it unacceptable for use. Number 5, apply the cast tape. The synthetic tape is applied over the cast padding. Highlight those 2 sentences. The provider wears rubber gloves during the procedure to protect the hands from the casting material. The tape is wrapped over the body part using a spiral turn until the desired number of layers have been applied. Generally, 3 to 4 layers are applied for a non-weight bearing cast, for an example, short arm or long arm cast, and 5 to 8 layers are applied for weight bearing cast, for example, short leg cast or long leg cast. Number 6, allow the cast to dry. Highlight that sentence. The cast is allowed to dry for a period of time specified by the manufacturer. A fiberglass cast usually dries within 30 minutes. Highlight that. Only when a cast is completely dry does it become hard and inflexible and able to bear weight. The provider usually prescribes a supportive device such as a sling or crutches to prevent unnecessary strain and to minimize swelling during the healing process. Precautions. The following precautions should be observed during and after cast application. Remove excess casting particles. Remove synthetic casting material with a swab moistened with alcohol or acetone. If the cast particles are not removed, they may work their way under the cast, resulting in irritation and infection. Before the patient leaves the office, the provider checks the circulation, sensation, and movement of the exposed extremity to ensure that the cast is not too tight. The provider also ensures that all joints excluded from the cast are free to move. Guidelines for cast care. The medical assistant is often responsible for explaining or reinforcing the guidelines that should be followed by a patient with the cast to promote the healing process. These guidelines are often presented on an instruction sheet that is signed by the patient with the copy filed in the patient's medical record. Guidelines for cast care include the following. Nancy, can you go ahead and read the first 3 bullet points?
Allow the cast for putting on the cast. Synthetic cast weigh approximately 30 minutes to 1 hour after application. Elevate the cast above heart level for the first 24 to 48 hours to decrease swelling and pain. This can be accomplished by propping the cast extremity on pillows or some other type of support. Gently move the toes or fingers frequently to prevent swelling and joint stiffness and to increase circulation.
Okay, you're going to highlight the first sentence on the second bullet point and the first sentence on the third bullet point. Natalie, can you go ahead and read the next 3 bullet points, please?
Apply ice to the casted extremity to reduce swelling. Place small pieces of ice in an ice bag and loosely wrap it around the cast at the level of the injury. Take precautions to prevent dirt, sand, powder, and other foreign particles from becoming trapped under the cast. They can cause irritation to the skin, leading to infection. Do not apply powder for itching under the cast. Do not use any object to scratch the skin under the cast. Inserting anything under the cast, such as a pencil, coat hanger, or knitting needle, may cause a break in the skin, which could become infected. Also, the object may become lost in the cast.
All right, very good. In that third bullet point, you're going to highlight where it says, do not use any object to scratch the skin under the cast. Inserting anything under the cast, such as a pencil, coat hanger, or knitting needle, may cause a break in the skin, which could become infected. All right, Sabrina, can you please read the next 3 bullet points?
Do not engage in activities that could cause injury because of impairment of your physical abilities. Keep the cast dry. When taking a bath or shower, cover the cast with a plastic bag and secure the bag to the skin with waterproof tape. If possible, hang the casted lamp over the side of the tub or outside of the shower. Although the material making up a synthetic cast is moisture resistant, the cast padding is not. If the synthetic cast becomes wet, it must be dried as soon as possible to prevent maceration. Maceration is the softening and breaking down of the skin, which can lead to infection. To dry a wet cast, first blot the outside of the cast with an absorbent towel. This should be followed by the application of a blow dryer on low setting using a sweeping motion over the entire cast until it is completely dry. The patient should be instructed not to use the high setting on the blow dryer because this amount of heat could burn the skin.
All right, very good. So on that third bullet point, you're going to highlight the first 2 sentences. All right, Talia, can you please read the last 2 bullet points?
On 220,
On 222, right above symptoms to report, just those last 2 bullet points.
inspect the skin around the cast at a regular interval to check the redness, sores, or swellings. Do not trim the cast or break off any rough edges because this may weaken or break the cast. If the surface of the cast has a rough edge, a metal nail file or emery board can be used to smooth it. Notify the provider if the cast becomes loose, broken, or cracked because the cast may need to be replaced.
All right, very good. Symptoms to report. Alicia, are you where you could read symptoms to report?
Yeah.
Okay.
The patient should report the following symptoms immediately to the provider. They may indicate that the cast is too tight or an infection is developing. Increased pain or swelling that does not go away with application of ice bag, medication, elevation, or rest. A feeling that the cast is too tight. Slight pressure applied with the thumbnail to the fingernail or toenail should cause it to blanch, white, and then when the pressure is released, the nail should immediately return to its normal color. If this does not occur, it should be indicated insufficient blood flow to the extremity from a cast that is too tight, tingling, numbness, or loss of movement of the fingers or toes, coldness, paleness, or blueness of the fingers or toes, painful rubbing, burning, or stinging under the cast, foul odor, or drainage coming from the cast, some areas around the edge of the cast, or areas around the edge of the cast, chills, fever, nausea, or vomiting.
All right, very good. So you're going to highlight the last 1, 2, 3, 4, 5, 6 bullet points. All right, Jasmine, go ahead and read cast removal, please.
The easiest and safest way to remove a cast is to bivalve it. This means cutting the cast into 2 halves, resulting in an interior shell and a posterior shell. To bivalve a cast, the provider cuts the entire length of the cast on 2 opposite sides down to the level of the cast padding. The cuts are made with the cast cutter. A cast cutter is a handheld electric saw with a circular blade that oscillates, which means the saw vibrates but does not rotate. Medical assistants should reassure the patient that Although the saw is noisy, only a tickling sensation and some heat are felt from the saw's vibration. After cutting the cast, the provider pries it apart with a cast spreader, figure 7.9b. Next, the provider uses bandage scissors to cut through the cast padding and stockinette, figure 7.9c. The cast is carefully removed from the patient's extremity. The skin of the affected extremity typically appears yellow and scaly. The extremity also appears thinner and the muscles are flabby. The medical assistant should explain to the patient that this is normal and results from lack of use of the extremity. The provider may recommend exercises or physical therapy or both to help the patient regain strength and function of the body part.
All right, very good. So in the last paragraph, you're only going to highlight where it says the extremity also appears thinner and the muscles are flabby. All right, case study number 2. Christina Themes calls the office. 2 days ago, Christina fell while she was inline skating and broke the radius and ulna of her right arm. The physician applied a long arm fiberglass cast. While at the medical office, Christina received oral and written instructions on how to care for her cast. Christina says that in all the confusion, she misplaced the instructions. She said she didn't want to bother anyone at the office, so she did what she could to make her arm feel better. She says that it didn't work because now her arm is swollen and hurt. She took a bath and the cast got wet, so she wants to know how to dry it. Christina asked if it would be possible to have one of those removable casts so she can take it off when she takes a bath. All right, so what are you going to do?
I think that we should book her an appointment to come get a new cast because you're not supposed to get them wet.
Okay, what else?
Have her come back in, and we would just have to explain to her that she can't have one of those removable casts just because she needs something that's going to stabilize her arm so that way it has proper healing and it doesn't heal all crazy.
Okay.
But she can't like remove it. Explain to her one more time and give her written instructions as well that she shouldn't take a bath and she should follow the proper instructions.
Okay. All right, is there anything else?
And reassure her that she's not going to bother anyone at the office if she has any questions because that's what you're here for.
Very good. All right. Anything else?
If she has one of those, if they give her another cast like the hard one she had, she can use for taking a bath so she cannot wet it. She can use like those cast bags.
Yes, so they make cast bags now, and if your patient, because some patients can't find them or may not have the proper resources to get one, they can use trash bags and tape. Kind of does the same thing. But yeah, so she asked if she could just do one of the removable ones. The problem is that we don't want to tell her that, oh yeah, let's get you an appointment, because honestly, if the provider thought that she could get that, then that probably would have been an option to begin with. But the fact that it wasn't, that means that the cast actually would be the better choice. So we need to just go over, the proper instructions so she gets the full care out of the cast that was already placed on her. So, all right, very good. Anything else on this one? All right, Lily, can you please read the first 2 paragraphs under splints and braces?
Along with casts, splits and braces are used to assist in the treatment of fractures. A splint is a rigid removable device used to support and immobilize a displaced or fractured part of the body. Splints also are commonly used to protect areas that are sprained or strained. Splints are molded to fit specific parts of the body and are well padded to provide patient comfort and to prevent pressure areas. A splint can be custom made by an orthopedist using plaster or fiberglass casting materials. Splints also are commercially available and consist of two parts: a rigged material such as plastic or fiberglass and straps with Velcro that hold the splint in place. The splint may be applied initially to a fractured limb because it can be adjusted to accommodate swelling from injuries more easily than a cast. After the swelling subsides, a cast is usually applied. When the fracture is almost healed, the cast may be removed and another splint applied. This allows for bathing of the extremity and an easy removal for therapy until the fracture heals completely and the splint is no longer needed.
All right, very good. Thank you. So you're actually just going to highlight the second sentence on the first paragraph. All right, Nancy, can you go ahead and read the next paragraph, please?
Did you say highlight a splint may be applied initially?
Highlight where it says a splint is a rigid, removable device used to support and immobilize a displaced or fractured part of the body.
That part. Thank you.
You're welcome.
All right, and read a brace is designed.
Yes, ma'am.
A brace is designed to support a part of the body and hold it in its correct position to allow for functioning of the body part while healing takes place. An example of a brace is a short leg walker, which consists of a rigid, lightweight frame with a removable padded liner. A short leg walker is often used instead of a cast. To heal a stable fracture of the lower leg, a short leg walker is available in different sizes so it can be properly fitted to extend from just below the patient's knee to the toes. Special fasteners or straps with Velcro are used to hold the walker in place and allow for adjustment of it. A short leg walker permits walking and standing, which encourage healing. It also can be removed to permit bathing of the leg.
All right, very good. Thank you. Okay, so you're going to highlight the first sentence and the third sentence.
In which one? I'm sorry.
Where it says splints and braces, the third paragraph. It's the first and third sentence.
Thank you.
You're welcome. All right, Natalie, can you go ahead and read ambulatory aids on page 224, please?
Mechanical assistive devices are used by individuals who require an aid in ambulation. The word ambulation means walking. Patients who are ambulatory are able to walk as opposed to being confined to a wheelchair or a bed. Ambulatory aids include crutches, canes, and walkers. The device use depends on factors such as the type and severity of the disability, the amount of support required, and the patient's age and degree of muscular coordination. The ambulatory aid may be prescribed for a temporary condition such as fracture, a sprain into a lower extremity, and disability after orthopedic surgery. It also may be prescribed for a long-term condition such as paralysis, deformity, and permanent weakness of the lower extremities.
All right, very good. So on this one, you're going to highlight the second sentence and the fourth sentence. All right, crutches. Sabrina, can you please read the first two paragraphs?
Crutches are artificial supports that consist of wood or tubular aluminum. They are used for patients who require assistance in walking as a result of disease, injury, or birth defects of the lower extremities. Crutches function by removing weight from the legs and transferring it to the arms. The two main crutch types are the auxiliary crutch and the forearm crutch. The auxiliary crutch and the forearm crutch require rubber tips which increase surface tension to prevent the crutches from slipping on the floor. The auxiliary crutch is used most frequently and is made of wood or tubular aluminum. This type of crutch has a shoulder rest and hand grips and extends from the ground almost to the patient's axilla.
Very good. Okay, in the second paragraph, I just want you to highlight the words auxiliary crutch. All right, Talia, can you please read the next paragraph?
The forearm.
Yes, ma'am.
The forearm crutch, also known as the latch-strung crutch, consists of a single adjustable tube of aluminum that extends to the forearm. A metal cuff attached to the crutch first securely around the patient's forearm, and a hand grip covered with rubber extends from the crutch for weight bearing. The metal crutch and hand gripping stabilize the patient's wrist to make safer and easier. One advantage of the forearm crutch is that the individuals can rely on the hand grip, enabling use of the hand while the metal cuffs holds the crutch in place. Individuals who are paraplegic or have cerebral palsy use the forearm crutch most often.
All right, so on the third paragraph, I want you to highlight the words the forearm crutch and highlight where it says one advantage of the forearm crutch is that the individual can release the hand grip, enabling use of the hand while the metal cuff holds the crutch in place. Individuals who are paraplegic or have cerebral palsy use the forearm crutch most often. All right, auxiliary crutch measurement. Alicia, are you where you can read that?
Yes.
Okay.
The patient must be measured for auxiliary crutches to ensure the correct crutch length and proper placement of the hand grip. Incorrectly fitted crutches increase the patient's risk of developing back pain, nerve damage, and injuries to the axillae and palms of the hands. Procedure 7.7 presents the correct way to measure a patient for auxiliary crutches. If the crutches are too long, the shoulder rests exert pressure on the patient's axillae. This can injure the radial nerve in the brachial plexus, which eventually may lead to crutch palsy, a condition of muscular weakness in the forearm, wrist, and hand. In addition, crutches that are too long force the patient's shoulders forward, preventing the patient from pushing his or her body off the ground. Crutches that are too short force the patient to bend over and uncomfortable what? To be bent over and uncomfortable, also making them awkward to use. If the hand grips are too low, pressure is put on the patient's axillae, whereas hand grips that are too high are awkward. Wooden crutches are I'm reading weird today. Wooden crutches are made with bolts and wing nuts, which allow proper adjustment of the length and hand grip. Aluminum crutches consist of aluminum tubes, spring-loaded push buttons on the inner tube that pop out into holes on an outer tube to allow proper adjustment of the crutch length.
All right, very good. So in the first paragraph, I want you ladies to highlight where it says incorrectly fitted crutches increase the patient's risk of developing back pain, nerve damage, and injuries to the axilla and palms of the hands. In the next paragraph, you're going to highlight where it says this can injure the radial nerve and the brachial plexus, what eventually may lead to crutch palsy. All right, crutch guidelines. It's important that the patient receive specific guidelines to ensure safety while using crutches to prevent injuries and falls. The medical assistant is responsible for instructing the patient in the following guidelines. Okay, so you are going to highlight number 1, the first sentence on number 3, number 4, and the first sentence on number 7. So we're going to go over. All right. Jasmine, can you please read 1, 2, and 3?
1. Wear well-fitting flat shoes with firm, non-skid soles to provide good traction and stability. 2. Use good posture to prevent strain on muscles and joints and to maintain proper body balance. 3. Support your weight with your hands on the hand grips and the auxiliary pads, pressing against the sides of the rib cage. The body weight should not be supported by the axillae because pressure on the axillae may cause crutch palsy.
All right, very good. Lily, please read 4 and 5.
4. Look ahead when walking rather than down at your feet. 5. Be aware of the surface on which you are walking. It should be clean, flat, dry, and well lighted. Throw rugs and objects serving as obstacles should temporarily be removed from your environment to prevent falls.
All right, very good. Nancy, can you read 6 and 7?
Keep the crutches about 4 to 6 inches out from the side of your feet when walking to prevent obstruction of the pathway for the feet. Take steps by moving the crutches forward a safe and comfortable distance, preferably 6 inches. When first learning to use the crutches, take small steps rather than large ones. Do not move forward more than 12 to 15 inches with each step. A greater distance might cause the crutches to slide forward and you lose your balance.
Yep. Fun fact, don't do that. It hurts when you fall. All right. Natalie, please read 8 and 9.
Report tingling or numbness in the upper body to the provider. You might be using the crutches incorrectly or they might be the wrong size for you. Extra padding can be added to the shoulder rest of the crutches to make them more comfortable. If you do this, ensure that the extra padding does not press against your axillae, but rather against your lateral rib cage. The hand grips also can be padded for increased comfort.
Sabrina, can you go ahead and read 10, 11, and 12?
To prevent slipping, keep the crutch tips dry and maintain their surface friction. If they become wet, dry them completely before use. Inspect the crutch tips regularly. They should be securely attached. If the crutch tips are worn down, they should be replaced with tips of proper size. For wooden crutches, periodically check the wing nuts holding the central strut and hand grips into place to ensure that they are tight.
Very good. All right, Talia, can you please read crutch gaits?
The type of crutch gauge used depends on the amount of weight the patient is able to support one or both legs, and the patient's physical condition and muscular condition. The patient should learn fast and slow gaits. The faster gait is used to make speed in open areas, and the slower one is used in crowded places. In addition, learning more than one gait reduces patient's fatigue because of different combinations of muscles is used for each gait. Procedure 7.8 provides guidelines and charts for use in the instructing the patient on how to walk with crutches.
Very good. All right, canes. Alicia, can you go ahead and read the first paragraph, please?
A cane is a lightweight, easily movable device made of wood or aluminum with a rubber tip and is used to help provide balance and support. Canes are generally used by patients who have weakness on one side of the body, such as patients with hemiparesis. Paresis, is that right? Hemiparesis?
Yes, that's right.
Okay. Joint disabilities or defects of the neuromuscular system. The three main types of canes are standard cane, the tripod cane, and the quad cane. The standard cane provides the least amount of support and is used by patients who require only slight assistance for walking. The tripod and quad canes have 3 and 4 legs, respectively, a bent shaft and the T-shaped handle for grips. They are easier to hold and provide greater stability than a standard cane because of the wider the base of support. In addition, multi-leg canes are able to stand alone, which frees the arms when the patient is getting up from a chair. The disadvantage of a multi-leg cane is that it is bulkier and more difficult to move. Did you want me to read all of it?
Yeah, you can go and finish it if you want.
Okay. A cane is held on one side of the body, opposite that the side that needs support. The cane length must be properly adjusted to ensure optimal stability. The cane handle should be approximately level with the greater trochanter, and the elbow should be flexed at a 25 to 30 degree angle. The patient should be instructed to stand erect and not lean on the cane to ensure good balance. Procedure 7.9 presents guidelines on instructing the patient on how to walk with the cane. I'm sorry, guys. I don't know what's wrong with me today.
No, that's okay. It just happens. It's just that kind of day. All right, so in the first paragraph, I want you to highlight on page 225 the words "and is used to help provide balance and support." Highlight canes are generally used by patients who have weakness on one side of the body, such as patients with hemiparesis, joint disabilities, or defects of the neuromuscular system. In the second paragraph, just highlight the first sentence. Walkers. A walker is an ambulatory aid consisting of an aluminum frame with hand grips and 4 widely placed legs with rubber suction cups and on one open side. A walker is light and easily movable. Walkers are available with wheels that facilitate movement of the walker. They are also available with a fold-up feature that allows them to be easily transported in a vehicle. For proper ambulation, the walker should extend from the ground to approximately the level of the patient's hip joint. Procedure 7.10 prevents guidelines on instructing the patient on how to walk with the walker. Walkers are used most often by geriatric patients with weakness or balance problems. Highlight that sentence. Walkers are also used during the healing process for patients who have had knee or hip joint replacement surgery. These patients need more help with balance and walking that can be provided by crutches or a cane. Because of its wide base, a walker provides the patient with a great amount of stability and security. Disadvantages of a walker include a slow pace and difficulty in maneuvering the walker in a small room. Case study number 3. Thaddeus Bernard calls the office. Thaddeus fractured the femur of his left leg 2 weeks ago in a skiing accident. The physician applied a long leg fiberglass cast and Thaddeus was properly fitted with aluminum crutches. He is complaining of weakness in his forearms and hands and some tingling and numbness in his fingers. He also says that he has bruises under his arms. Thaddeus says that after he got home, his crutches didn't seem to fit right, so he readjusted them. Thaddeus is getting ready to return to college and wants to know the best way to carry his books while using crutches. All right. What would you do?
So he's having some problems with his crutches because he readjusted them. Maybe he can readjust them to a place that helps, or maybe he can come back in and we can help him readjust them to a better, because obviously he has tingling and bruising and stuff. But I guess the best way for him for college is either get a backpack. So obviously he can't use his hands, or maybe have a friend that can help him carry his books.
Yeah, I mean, really, so yeah, I would probably more recommend him coming back into the office because when we fitted his crutches, we fitted them appropriate to him. So if he was having some sensations or if his sensations or symptoms started occurring after he readjusted them, then we need to see what's going on and just physically be able to see and go over him on readjusting them. And honestly, probably a backpack's going to be the best thing for him with his books. So, good points. All right, anything else that we would do or even what we don't want to do?
We don't want to tell him that it's okay that he carries his bag or his books because he shouldn't.
Right. Yeah, he needs to be really careful about, I mean, it's actually really common for patients to do this, right? When after they get fitted in their crutches, they think that because it's new, right? Patients are not used to having to walk or use crutches. So once we adjust them, they usually think, oh, well, this is like really uncomfortable, so let me readjust them, right? No, we already adjusted to fit properly. So as far as with a college student, it's also really common, and we don't want him to injure himself, right? Like if you can imagine in crutches and a book bag in one of your hands, that is going to be very difficult, and I see an accident just waiting to happen if he does that. So, you know, definitely want to give him options that's going to prevent any further accidents or further him injuring himself. All right, very good. Any questions over anything? Okay. So go ahead and turn to page, or look on to page 227. I want you ladies to highlight on number 4, procedural step, just that first sentence right above the first bullet point. On page 228,
What
you're
was that?
going to highlight. I'm sorry?
I'm sorry, what did you say now?
That's okay. Number 4, procedural step, that first sentence above the first bullet point. And then on page 228, number 2, you're going to highlight the first sentence under principle. On this same page, on the 4-point gate, highlight that first sentence. On page 229, on 3-point gate, highlight the first sentence. And that, ladies, includes chapter 7. So this one's really good. We're going to practice some of this when we get into the clinic. But just make sure that you read it over, read the procedures, and then today you're going to do just the chapter 7 evolve assignments. And then don't forget to send me your chapter 19 study guide results if you've not already. I sent an email this morning. It is urgent that you read the email and let me know that you've reviewed your grades. If there is a concern about your grade, you are to email me or send me a message so we can discuss it. Because as of this morning, all assignments that I've received, all but chapter 19 study guide, have been posted, which means those zeros were logged. So please make sure that you review over that. If you have any questions, let me know. And then for the 1 o'clock lecture, remember, I'm going to do again the open floor discussion. So whether it's chapter 7 or any other chapters or just anything that you ladies want to go over that you're struggling with, you can do so at that point. It's an open floor. All right. Any questions before we end this morning's lecture? Okay. All right. Well, then I will see you guys either today at 1 o'clock or I'll see you tomorrow morning.